professor in Department of Dermatology. I'm from Nepal, and today I'm going to present in our one of the most strenuous topics in dermatology, all of us know, melasma and its treatment. So I'm hereby sharing my slide, Efficacy and Safety of Platelet-Rich Plasma Therapy in Melasma using microinjections and microneedling. Next, please. So being a derm practitioner, we all know that how much we are tired of treating melasma, and we are all aware of its recurrences. So cosmetically disfiguring disorder, which is very recalcitrant, and all of us know it is an acquired hyperpigmented skin disorder, and various treatment and modalities are used, but relapses and recurrences are common. Next, please. So the objective of our study was to compare the therapeutic efficacy and safety of PRP injections versus with microinjections versus PRP with microneedling in melasma. Next, please. So what we did was we all the male and female patients, most of them were females, of any age with melasma, we was the inclusive criteria that were presented in our OPD, dermatology outpatient department. The patient, we could not segregate patient without treatment because all of them were under some kind of over-the-counter or prescribed medicine. So we took all of them with or without previous treatment and with informed consent. The Fitzpatrick skin type was 3F4. Next, please. So as all of us know that PRP has been gaining recently much attention in the various fields like orthopedics, plastic, dental surgery, and dermatology as such also. PRP is a plasma containing higher than normal concentrate of platelets that is prepared by centrifugation. So more than 1 million per microliter platelet concentration is believed to be enough for therapeutic effect. So going to our basic science days, we all know that after PRP comes in contact with collagen, the granules inside the platelet will be activated and then it's fused to cell membrane to release the growth factors such as platelet-derived growth factor, epidermal growth factor, transforming growth factor beta. So these secretory proteins are induced to an active state by the addition of histones or carbohydrate side chains. So the secretion of these active proteins are followed by binding of transmembrane receptors and affecting many cell types. And this causes gene sequencing, controlling many functions, including collagen synthesis, which we are more concerned about, tissue regeneration and cellular proliferation, which is very essential in case of melasma because epidermal skin is damaged by various stress response. So within 10 minutes after activation, these growth factors are secreted, and we had strictly seen that PRP, after it gets activated, it should be used within 1 hour, so that our time frame was almost 1 hour. So next slide. Here we 10 ml of autologous whole blood was collected into a tube containing acid citrate dextrose and was centrifuged in a standard centrifugation machine, 1500 RPMs for the first 10 minutes in order to retain PRP at the top of the test tube, and then again at 3700 RPM for another 10 minutes at room temperature. Next slide. So PRP collected here was the plasma. Our plasma was made in which the platelets were in high concentration and it was resuspended. Next. So this is the instrument which I used. It is a microneedling pen for my derma pen, and then these are the plastic disposable tubes for to prevent cross-contamination. This was the platelet yield, how we had a good amount of platelet yield, 1594 into 10 to the power per microliters, 1217, 1577, and 1804. Next slide. So it is a prospective randomized open label study, and 64 was the total number of patients. 32 were segregated for microinjections. No randomized trial. This is not a randomized trial, so we purposely separated the patients for microinjections and microneedling. 32 in each arm. On the left side of the face was treated by microneedling using Dermapen. PRP was applied over the area, and Dermapen, the one I showed initially, we stressed the skin, and Dermapen was rolled in both the direction. 1 to 1.5 millimeter was the depth used, and it had 32 stainless steel needles for microneedling, and both in horizontal and vertical direction. We repeatedly did the procedure 4 to 5 times over the left side of the face. The right side of face was treated with the multiple microinjections of PRP. We used 100 units per ml insulin sterines with it was a 4 millimeter meso needle, and there was 1 centimeter intervals within each injections, and both the procedures were done for 3 sessions. Patients were called at the interval of 1 month. The final clinical assessment was done 1 month following the last session. We have strict follow-up protocols were followed using whatever devices we had. Mostly we did phone calls, and some also sent us emails if they were far, because the landscape is very poor in our country and it's not possible for patients to travel long distances. So later on, in between the sessions also, we were in constant communication with the patients, but at 1 month they were strictly followed up and sequential photographs were taken. Next, please. So talking about the pre-procedure care, whenever possible, we ask the patient to avoid the use of any NSAIDs for 14 days before the treatment, and the sun exposure to be avoided at least 24 hours before treatment. The sun exposure mostly was targeted from 8 AM to 2 PM. So during the procedure, we immediately before the procedure, the patient was asked to wash the face, and disinfection was done with 70% alcohol. Then a topical lidocaine cream, eutectic anesthetic, was applied to the face. It was left for 30 minutes, and then we initiated both the procedures. After the procedure, we asked the patient to wash the face, but after 24 hours only, because PRP, whatever we used, it was supposed to stay on the face. And then application of topical antibiotic cream, physicic acid, was used. And whenever possible, no exposure to strict sunlight for at least 7 days after the procedure. The sunlight, we told again, was sun exposure from 8 AM to 2 PM. And if needed, sunscreen on and off before sun exposure. And patient will instructed to sleep with head elevated for 2 nights to minimize any kind of swelling. Talking about the clinical assessment, as I said earlier, serial clinical photographs were taken, and MASI scoring was used for clinical assessment along with physician global assessment and patient global assessment, PTGA, at every month, and also any adverse events and complications were recorded. But today I'm only talking about MASI, PGA, and PTGA in our presentation. So here we can see that MASI at baseline, MASI at 4 weeks and MASI at 8 weeks. So MASI at 4 weeks has decreased from 16.86 to 16.1 with patient with microinjection, but shown much better improvement, 16.6 for those with microneedling with PRP. Similarly, at 8 weeks, it has further reduced to 14.6, quite a good number in case of microneedling group, and 15.4 in case of microinjection group. So percentage improvement was 42.64 in microinjection group, but it was much higher in the patient with microneedling group, 63.18. Next slide, please. So here we can see that total MASI at each visit was recorded at 4 weeks and 8 weeks. 8 weeks and at baseline. So at baseline, 264 was the total MASI, which downgraded to 242 in microneedling group, further to 212 in microneedling group at 8 weeks of treatment, and similarly 264 to 250 at 4 weeks in microinjection group, and further to 236 at microinjection group. So here we can see that microneedling group, there is further much reduction in total MASI compared to microinjection group at 8 weeks post-visit. Next slide, please. So similarly, talking about the physician global assessment, here we can see that in the microneedling group, there is 50% compared to 70.3% in microinjection group, and there is moderate improvement, 37.5% in microneedling group compared to 25% in the microinjection group. So similarly, PTG, that is a patient global assessment, that was done by a questionnaire. It is seen that in microneedling group, it is 12 compared to 8 in microinjection group, very mild, and in moderate improvement, that is 56.25 in microneedling group compared to 37.5 in microinjection group. So here are the few pictures I want to share. So this is for before microneedling a patient. She was on the treatment with multiple hydroquinone and kojic acid, and 12 weeks post microneedling, there you can see very much improvement in density of melasma as well as homogeneity, and also the areas of involvement. If we see, it is far more clear both in the malar area, in the chin, and in the forehead. Next, please. So this is before microneedling. Even the tiny scars have also been removed compared to the before microneedling post in after 12 weeks, and the overall skin texture has also improved, and the density of melasma has also decreased. Next, please. So in this picture, we can see lightening of the melasma, density of the melasma before microneedling and 8 weeks post microneedling over the forehead and the right malar area. Next. So this is a picture again. So these are the type of melasma we commonly see in our part of the world, as we are FISPATIC 3 and 4. So eight weeks following treatment, she was very much happy because her skin was glowing. It was very healthy. The melasma density of melasma had decreased both in the forehead, nose, her chin, and also in the malar area, where we can see the improvement 8 weeks post follow-up following microneedling. Next. So this is again the same patient. Here you can see the quality of the skin has improved. The density of melasma has decreased over the forehead and the left malar area. This is 12 weeks post microneedling. The patient is on the follow-up. So even with microinjections, we had good results. So here we can see the decrease in the density of melasma and the homogeneity in the forehead and the left malar area, 12 weeks post microinjections. Next. So this is again the same patient, her right malar area. We can observe good improvement over the forehead and the left malar area. So this is again another patient. She has diffuse melasma over her malar area and also few over the forehead and mostly over the chin. So we can see drastic improvement of this patient, comparative increase in the homogeneity and density of melasma over the cheek area, forehead, and her overall skin quality has also increased a lot. So this is following microinjections. Next slide. So this is also 12 weeks following microinjections. Here you can see still melasma is persistent, and the patient complained that after her microinjections, she noticed gradual increase in melasma over her lower malar area and over the chin, which was not present earlier. Similarly, in the picture also we can see that, but overall her melasma has decreased over the malar area. So next slide. The same picture, the same patient. On the next slide, we can compare the differences. So this is again a patient who was very frustrated with multiple treatments in many centers of the valley, and we opted her for microinjection, and she had drastic improvement in density and homogeneity. After 3 months, she was very satisfied with the results. Same patient on the next slide, and also we can compare the forehead area. So these are the results of microinjections and microneedling, but obviously the patient has to stay on close follow-up, and the sessions have to be repeated. I only took treatment interval of 3 months period and follow-up after that, but the patients are still now in closer follow-up to prevent any recurrences, but obviously the time duration has increased. Previously, we used to do microinjections and microneedling in 1 month. Now the follow-up is every 3 months. So concluding my presentation, the efficacy from our study, obviously, as we saw, was higher in the group with microneedling. Probably it was because of the deeper penetration of PRP and delivery through various channels, which was created with microneedling. So the take-home messages from my slide would be, we all know how frustrated we are treating melasma in various parts of the world. So PRP can be a very safer, economical, and an efficient adjuvant in the treatment of melasma, provided the maintenance is done. Thank you very much. Thank you so much.